The Ministry of Health and Estama Investments Limited want Kenyans to pay 600 million shillings to distribute and install the mobile container clinics.
Now, the portable clinics that were procured by Estama Investments Limited back in 2015 at a cost of 1 billion shillings in what later turned out to be a scandal have been lying idle in Miritini in Mombasa County.
The National Assembly Committee on Health inspected the containers at the NYS yard and discovered that some of the equipment supposed to be inside is missing and some have been vandalized.
Well, NTV's Coast reporter Kevin Mutai reports that the MPs maintain they will not approve any money until the containers are dispatched to respective counties as per the contract agreement indicated in the tender document.
Where are the microscopes? Because this is an empty box. The microscope should have been here.
The situation at the National Youth Service Camp in Miritini, Mombasa, Thursday noon, when the Committee on Health inspected the controversial 1 billion shillings mobile container clinics, and some of the equipment supposedly installed in the containers was found missing.
The prices for these containers were really exaggerated.
10 million shillings.
10 million for such kind of a container.
The containers have been rotting away slowly since the first batch arrived in the country in 2015. The Ministry of Health has disclosed that there is no money to transport them to the counties even after Estama Investments Limited was given a down payment of 800 million shillings to supply, deliver and install the portable clinics.
Things like microscopes, they are only the empty boxes. We believe that they have been vandalized, the microscopes are gone. We have looked at some of the containers. They are only full of chairs, and another container is full of the bars to do the canopy and the seats. So for me, it is a total mess.
The committee claims that the Ethics and Anti-Corruption Commission had investigated the procurement of the equipment and cleared the supplier, while ignoring the fact that the Kenya Revenue Authority had revealed that the firm spent 1.4 million shillings to buy and import each of the container clinics and then sold them to the government at 10 million shillings each. The containers were allegedly supposed to have been assembled in the country, but the supplier ended up procuring them from China.
The Ministry of Health has claimed that they have inspected. So that inspection report, particularly physical report, also we want to avail.
Kama sisi kama kamiti ya SWA tumekuja hapa kuona kitu ya kwanza ile pesa serikali ililipa nini.
But this has been a thorn in the flesh. But I think we have come to a conclusion that this was a shoddy job deal. Kenyans have lost money.
The MPs met with officials from the Ministry of Health and Estama representatives, but still they did not find common ground as they were denied access to crucial tender documents, including delivery notes.
We are disappointed as members of parliament for what we have seen. And I can assure you, even if this container is taken to wherever they want to take them, at the end of the day, Kenyans will have to go back and dig bigger into their pockets to make sure that the containers are working.
The ministry, however, plans to employ health workers and attach them to the clinics despite the role given to county governments. Upon their inspection, members of the Health Committee in the National Assembly say they are not satisfied with what they have seen, maintaining that their report will contain many questions that will be demanding for answers from the Ministry of Health. Kevin Mutai, NTV, from Miritini in Mombasa County.